My name is Ashley, and I'm going to be showing you how to check a blood pressure. Okay, so the first thing you do is choose the appropriate size cuff for your patient. And this is called a blood pressure cuff. This is a stethoscope. This is what you will use to listen to the pulse. So I have already measured her arm, and I know what size is appropriate for her, so I'm going to place this around her upper arm. You can use the upper part of the arm or the lower part. This is ultimately where the site you would want to use unless they have a shunt or they have had some type of lymph node removal on that side. Then you would want to avoid this arm and use a different extremity. Okay, so ma'am, can I check your blood pressure?
Yes.
Okay, so this is an appropriate size cuff, and it tells you here you want to line that up with the artery, and we're going to place the stethoscope over the brachial artery. This is a bulb. This little device right here, you want to rotate it right, lefty-loosey, righty-tighty. So it'll be to your right. And I'm going to inflate it up to 200, and then I'm going to listen for the top number is called the systolic, the bottom number is the diastolic pressure, and the first number that I hear will be her systolic pressure, and you typically want that between 120, between 100 and 120. Anything over that is pre-hypertension. Greater than 140 on systolic is considered hypertension. And diastolic pressure, which is the last beat that you will hear, you want that less than between 60 and 80, and if it's anything greater than 90 is considered hypertension. Between 80 and 90 is pre-hypertension. Okay, so I will inflate the cuff to 200, and that is measured in millimeters of mercury. Slowly deflate your cuff. And I got 148 over 88, so her pressure is good, although it would be considered pre-hypertension, and I would want to educate the patient that she would need to let her doctor know that her blood pressure was a little elevated, and I would also want to educate the patient on foods to avoid, any salty foods, things like that that could increase your blood pressure. And let's see. A few things to remember: causes of high blood pressure, smoking, obesity, endocrine factors such as diabetes, hypo or hyperthyroidism, physical inactivity, strong family history, like I said, high sodium intake, chronic renal disease, pregnancy, obstructive sleep apnea, stress and anxiety, and white coat syndrome, which is also like if you come in contact with anybody in the medical field. So that could be the reason why your blood pressure's up now.
Yeah, that's what I
Okay. And then if your blood pressure is up, you would want to educate the patient, limit their salt intake, speak with your physician about this, avoid smoking and alcohol, and increase your fruits and vegetables, and drink lots of water. So I hope you learned something today, and thank you very much.